Calcium channel blockers, two classes over here, dihydropyridines, DHPs, common suffix dipines, de high pressure. This is a mnemonic marked in pink. It is used to treat high BP. So de high pressure, DHPs, dihydropyridines, dipines, amlodipine, nifedipine. Non-DHPs, non-de high pressure, that is, it is preferably used for angina dysarrhythmias. These are non-selective, they work on all the calcium channels. It is used all the time with emergency patients with atrial fibrillation. All right, diltiazem and verapamil. Now, okay, so basically the calcium channels in the myocardium, basically the non-DHPs, what happens over here is that they block the inotropic effect. So there is a negative inotropic effect, all right? That is the cardiac contractility. Cardiac contractility is reduced. And for the heart rate, that is the chronotropic effect is also reduced, all right? It is used to treat hypertension, and the main point over here is the tocolytic effect. The tocolytic effect of calcium channel blockers, that is, it delays premature labor. Okay, toco, calcium, CC. It is dangerous in unstable angina due to reflex tachycardia. So two major points for calcium channel blockers is that it is a tocolytic agent and it is dangerous for unstable angina. It cannot be used in unstable angina. Why? Because it has the potential of causing reflex tachycardia. What is the mechanism? It blocks the calcium channels, minimal to no myocardial tissue, minimal to no effect on the heart rate for calcium channel blockers. Now, since calcium channel blockers have minimum effect on the heart rate, it cannot be used for atrial fibrillation dysarrhythmias. All right. Adverse effects are reflex tachycardia in calcium channel blockers. So we counteract this with a beta blocker. Orthostatic hypotension, which is seen in all hypertensive drugs, sexual dysfunction. Main thing over here to notice with calcium channel blockers is that it cannot be used for unstable angina. It causes peripheral edema, which is dose dependent, 10 to 15%, and no grapefruit juice. All right. So that's it. Then nursing considerations, again, avoid grapefruit juice. Now we go on to the thiazides. Thiazide, which is a diuretic, hydrochlorothiazide. It is used to treat specifically for hypertension. Thiazide is specifically used to treat hypertension. What is the mechanism? It acts on the distal convoluted tubule, all right, and inhibits sodium, magnesium, potassium, and chloride resorption. So adverse effects of these thiazides. The mnemonic over here. This is the mnemonic for the adverse effects: hypo-MNCK, hypergluc, and P2. What is hypo-MNCK? Hypo-MNCK is hypomagnesemia, hyponatremia, hypochloremia, and hypokalemia. What is hypergluc? Hypergluc is hyperglycemia, hyperlipidemia, hyperuricemia, and hypercalcemia. And what is P2? P2 is peeing and photosensitivity, along with sulfur allergy. Now, sulfur allergy is also seen with sulfamethoxazole trimethoprim antibiotic. Then hydrochlorothiazides. In hydrochlorothiazides, the important points to remember is that we have to take more potassium supplements with this. All right. It is a very cheap drug and it is the first line drug for hypertension. Nursing considerations, we assess the dehydration of the patient because of course it is a diuretic, the patient will have fluid loss. And we notify the provider if the creatinine clearance is less than 30 ml per minute. We cannot use this drug, it will not act. We encourage foods which are high in potassium. Because it's a diuretic, there is potassium loss as well. Hypokalemia is seen, so we need foods with high in potassium. Now, which are the drugs in which we do not require potassium? We should not take potassium. These are the RAS drugs. All right. The RAS drugs, no potassium. For this diuretic thiazides, we need potassium. Are you getting the hint with the kidneys? When in doubt, avoid NSAIDs and lithium accumulates. Okay, so when kidneys are involved, we should avoid NSAIDs and lithium accumulates. Now we go on to the IV forms, hypertensive urgency drugs. These are given as IV. The first one which we are discussing is the vasodilator hydralazine. This is IV push drug. All right. It is used to treat the mnemonic over here is H3. H for hydralazine and H3 over here for its uses. What is the H3? Hypertension, hypertensive urgency, emergency, and heart failure. What is the mechanism? It acts directly on arteries, causes vasodilation, and there is a decreased afterload. This is an important point. There is a decreased afterload. All right. Adverse effects. Adverse effects. Now, hydralazine, this is the mnemonic over here, RAL. Adverse effects is RAL. That is retention with long-term use and lupus-like syndrome. Okay. 5 to 10%. What is lupus-like syndrome? Type 3 hypersensitivity, antigen antibody complex, fever, arthralgia, myalgia, and nephritis. Then we go on to the next hypertensive crisis drug, which is sodium nitroprusside. It is a vasodilator. This is IV drip. It is titratable and it is used for acute decompensated heart failure. What is the mechanism? It acts on veins and arteries, decreases the preload vein component of how much blood goes into the heart, and afterload SVR that the heart has to pump against. Adverse effects. Now this is the important mnemonic over here for sodium nitroprusside. Russian soldier has cyanide tablet and hides from light. All right. So there is a slow gradual correction should be done for this drug. Cyanide toxicity is seen. What is cyanide toxicity? What are the effects? Delirium, disorientation, weakness, headache, cardiac abnormalities, and death. Cyanide antidote, sodium nitrite and sodium thiosulfate. And it should be protected from light. Nursing considerations, improved breathing, sometimes fluid backs up in the lungs. Okay. Now, the overall considerations for hypertensive drugs, antihypertensive drugs is we instruct the patient to report unusual shortness of breath, difficulty breathing, swelling of the feet, ankles, face or around the eyes, weight gain or weight loss, chest pain, palpitations, excessive fatigue. Beta blockers can cause heart failure exacerbation.